Before starting with the procedure, make sure to have your diagnostic tools complete, introduce yourself to the patient, wash your hands, then briefly explain to the patient what the examination involves, and don't forget to obtain consent. First, cranial nerve is usually evaluated only after head trauma or when lesions of the anterior fossa are suspected, or when patients report abnormal smell or taste. Test the sense of smell by presenting the patient with familiar non-irritating odors. First, make sure that each nasal passage is patent by compressing one side of the nose and asking the patient to sniff through the other. Second, ask the patient to close both eyes, occlude one nostril, and test the smell on the other with substances like coffee, soap, or vanilla. You should do this on both of your nostrils. Avoid noxious odors like ammonia that might stimulate cranial nerve number 5. Ask the patient to identify each odor, test smell on the other side, and normally the patient will perceive odors on each side and identifies them correctly. The optic nerve should be examined by various modalities. Visual acuity can be assessed with the Snellen chart. Keep glasses on to correct any refractory errors. Stand the patient 6 meters away from the chart, covering each eye separately with their hand in turn. Find the line of print which the patient can comfortably read at. Visual acuity is expressed as the distance between the patient and the chart over the number next to the smallest line that was read. Example: 6/24 is an individual standing 6 meters away from the chart and can only read letters that a normal individual can read from 24 meters. For the visual fields, ask the patient to cover their left eye with their left hand and then cover your right eye with your right hand. The patient must continue to look straight ahead. Move your hand to the patient's upper temporal visual field quadrant. Then gradually move your finger to the center of their vision from the periphery, and ask the patient to inform you as soon as they see your finger moving. Repeat for the lower temporal, upper nasal, and lower nasal field, then repeat on the other eye. Any abnormality detected can be further assessed by perimetry or central field assessment. Test the visual fields by confrontation. Test each eye separately and both eyes together. Occasionally, in stroke patients, for example, patients will complain of partial loss of vision, and testing for both eyes reveals a visual field defect. An abnormality in the peripheral vision, such as homonymous hemianopsia, testing only one eye would miss the finding.
Ask the patient to fix on a target in the distance. Use your right hand and right eye to examine their right eye and your left for their left. Start with your feet close to the patient and lean back. Identify the fundal reflex and follow this, moving in on a path 10 to 15 degrees temporal on the horizontal. When you're close to the eye, the optic disc should come into view. Go in closer still and you will get a wider and more stable view. Comment on how distinct the margin of the disc is, the colour of the neuroretinal rim, and the cup to disc ratio. Then look for other signs along the 4 major branches of the retinal vessels. Finish by asking the patient to look into the light to bring the centre of the macula, called the fovea, into view. In a non-dilated eye, this will cause the pupil to constrict and you will lose the view. In a dilated pupil, the fovea can be seen as a slightly darker zone with a pinpoint reflection. Repeat this examination on the other eye.
For optic and oculomotor nerve, the pupil should be equal, round, and reactive to light and accommodation. Inspect the size and shape of the pupils. Compare one side with the other. anisocoria, or a difference of greater than 0.4 mm in the diameter of one pupil compared to the other, is seen in up to 38% of healthy individuals. Test the pupillary reactions to light.
For the pupillary light reflex, ask the patient to fixate on a distant target. Shine a pen torch into each eye in turn, bringing the beam quickly from the lateral side. Observe both the direct and consensual response of the eyes. For the pupillary accommodation, the accommodation reflex involves both convergence of the eyes and simultaneous constriction of the eyes. Ask the patient to look at an object held at a distance. Bring the object to within 10 cm of the patient, asking the patient to follow it with their eyes. Watch the pupils for equal convergence and constriction. Ask the patient to look straight ahead and check for signs of nystagmus or ptosis. Ocular movements. Ask the patient to keep their head still and follow an object. Move the object around in an H formation, assessing both horizontal and vertical gaze. Watch the pupils to assess the eye movements and any signs of nystagmus. Checking the conjugate gaze may also be warranted at this point. Ensure to ask the patient to let you know if they experience any double vision throughout the test. Trigeminal motor function is tested by palpating the masseter and temporal. In turn, ask the patient to firmly clench the teeth. Note the strength of the muscle contraction. Ask the patient to open and move the jaw from side to side.
For sensory, after explaining what you plan to do, test the forehead, cheeks, and chin on each side for pain sensation. The patient's eyes should be closed. Use a suitable sharp object such as a pin or a cotton swab. You can create a sharp wood splinter by breaking or twisting a cotton swab. To avoid transmitting infection, use a new object for each patient. While testing, occasionally substitute the blunt end of the point as a contrasting stimulus. Ask the patient to report whether each stimulus is sharp or dull and compare sides. For testing the corneal reflex, ask the patient to look up and away from you, approaching from the opposite side, out of the patient's line of vision. Avoiding the eyelashes, lightly touch the cornea, not just the conjunctiva, with the fine whips of cotton. If the patient is apprehensive, touching the conjunctiva first may be helpful.